A lot of people, when they come into Medicare, they're surprised that there's a cost to Medicare. Actually, a lot of people are shocked because they certainly assume that it was free because they paid into it all their working lives. But when you come into Medicare, there's absolutely costs involved, and we need to understand those because it's an important part of planning for retirement. We know how much we're going to have to spend on our medical coverage going forward. So I'm going to go through the costs of Medicare, really each piece, and break it down so you understand exactly how it functions and what it will cost you as you go along. And I'm Keith Armbrecht, founder of Medicare on Video. I help people cross country make the right Medicare choices. I can absolutely help you as well. Please feel free to use my information. I have a free book on Medicare that I'll show you how to download at the end. That's fantastic. You'll find it very helpful. Let's talk right now about the cost of Medicare. When you come in, just about every piece of Medicare has a cost. The only one that doesn't really is Medicare Part A. So Medicare Part A covers stuff that goes on inpatient in the hospital. It does have a big deductible, so it does have a $1,600 deductible, but we'll go through that a little bit later on stuff that will cover that deductible. But from a premium standpoint, Medicare Part A does not have a premium as long as you've worked for 40 quarters during your lifetime. It does not have a premium. If you have not worked the 40 quarters, then there would be a premium, and that can be a little specific. You're welcome to give us a call. We'll walk you right through that. But for most everybody, Part A does not have a premium. Now, Part B, different story. There is absolutely a premium for Medicare Part B. When you sign up for Part B, and you're either going to start your Part B when you turn 65 if you're ready to retire, or if you're going to stay at work and stay on your group health plan, you're going to keep that likely and not start Part B until you are ready to retire and come off your group health plan. Could be at 68, could be at 78. Just depends on how long you're on your group health plan. But when you do start your Medicare Part B, the premium currently is $164.90 per month. So it's important to understand that. And the way it works, how you're going to pay that, is if you are drawing Social Security, they will take that amount out of your Social Security check. If you are not taking Social Security, they're going to send you a bill. And when they send you a bill, it's going to be a quarterly bill. So they're going to send a bill 3 months at a time. So certainly need to prepare if that's the situation for paying for your Medicare Part B. Now, Medicare Part B also has a deductible when you use it. Medicare Part B covers things that goes on outside of the hospital, doctors, specialists, outpatient surgery. And in 2023, the deductible is $226. And again, we'll go through some things in just a minute on how some of that's covered and how it functions going forward. Now, important to understand with Medicare Part B, that premium is income adjusted. So they have what is called IRMA, and if you make over a certain threshold of income, it's going to increase that premium. You can see on this chart right here, it can be significant. So if you have significant income, your Medicare Part B premium can go all the way from $164.90 to $560.50 per month. So if you have significant income, that Medicare Part B premium can be as much as $560 per month. And again, if you're not drawing Social Security, they're going to send you a bill for 3 months. So for more than $1,600, you got to be prepared for that. So also important to understand, this Part B premium is going to be your responsibility regardless of whether you stay on original Medicare or whether you choose a Medicare Advantage plan. A lot of people think if they choose Medicare Advantage, they don't have to pay that Part B premium, but it's there no matter which road you take into Medicare. So it's important to understand that. If you've watched any of my other videos, you certainly know that I would 100% stay on original Medicare A and B with a Medicare supplement plan. I would not choose a Medicare Advantage plan for many, many different reasons. You can certainly find that on some of my other videos as well. On the cost standpoint, if you did choose a Medicare Advantage plan, so you got your Part B, you're going to pay your Part B premium. If you're going to choose a Medicare Advantage plan, they have costs as well, and they can have a premium. It can run anywhere from $0 to $200 a month. They show the average premium on Medicare Advantage is about $18 a month. And keep in mind, the lower the premium with Medicare Advantage, typically the more restrictive it is. So it'll have a smaller network, less hospitals, things of that nature within that Medicare Advantage plan. Now, the out-of-pocket in a Medicare Advantage plan is where it can get really expensive. So you need to understand that as well. It's kind of a pay-as-you-go. You'll have co-pays and you'll have out-of-pocket expenses within a Medicare Advantage plan when you use it. And it currently has a max out-of-pocket of $8,300. So if you had a really bad year and you're on a Medicare Advantage plan, it's possible to be out of pocket as much as $8,300 in addition to the Medicare Part B premium. So keep that in mind when you're making your choices. Sometimes they sell Medicare Advantage like it's going to give you everything, but you need to understand the out-of-pocket costs as well. Now, if you're going to choose to stay on original Medicare, A and B, you've got that Medicare Part B premium, you would likely get a Medicare supplement plan that covers that big $1,600 deductible on Medicare Part A. It doesn't cover the Part B deductible, but the Part B deductible is very small. It's only $226 right now in 2023. But it does cover the co-insurance and things like that. So when you're looking at a Medicare supplement plan, so you got your Part A, your Part B, you've got your Part B premium. Your supplement plan is going to cost anywhere typically between $50 a month and $200 a month. Depends on what we're going to choose. So you would have either a Plan G, a Plan N, or possibly a HDG, which is a high deductible G. And there are certain places where that fits. And what we do, our goal, if you're going to have a Medicare supplement plan, is to really try to get that premium as close to $100 a month as we can. If we can do it with Plan G, then that's great. If not, if G is high, then we're going to look to Plan N. Plan N is very close to G, just adds a $20 copay when you go to the doctor, $50 copay when you go to the emergency room, easy out-of-pocket stuff. But if the premium makes sense, again, the goal is to really target somewhere near $100 a month. So in some states, they are more expensive. You might be $120, $130, but in some states, it might be $80 or $90. So we want to get as close to that $100 a month. Now, you would also likely have a Medicare drug plan when you're going to be on original Medicare with a supplement. So drug plan is a separate piece, and it can be as little as $7 a month, or it can be more than that. It's really not a range of, it depends on the medications that you take. But we obviously want to make it as affordable as we possibly can. And again, the lowest cost is about $7 a month. Now, it is also income adjusted. And when you look at the Part D IRMA chart, you can see based on your income, it's going to add X amount per month to whatever that drug plan costs. So if it's the $7 a month drug plan and you make that significant income, it's going to add $76 a month to the $7. And you know, that's the way Medicare is set up. It is income adjusted, and that will raise the temperature on a lot of folks when they see how much more they're going to pay because they're making significant income. But anyway, we try to help manage that. And where this IRMA figures in, whether it's on Part B or on the drug plan, is they're looking at income from 2 years ago. So that's all they can see from a tax standpoint. They're looking at tax returns from 2 years ago. So a lot of times people don't make the income now that they did 2 years ago. And that's certainly understandable, and it is able to be appealed. So you can file an appeal, and generally it's worked pretty easily. I have all that information under the guides and forms section of my website. I have the whole brochure, I have the appeal form, everything that you need. If you're not making the income that you were 2 years ago, because now you're going to retire, you need to appeal that IRMA. I don't know if they call it a penalty, but it's an income adjusted premium for Part B and Part D. So that gives you a pretty good overview of the costs of Medicare. Number one, Part A, no premium for most everybody. Part B, definitely a premium right now, $164.90, income adjusted. Part D, drug plans, $7 or more, also income adjusted. Medicare Advantage can have a premium going in, can also have a very large out-of-pocket expense. Medicare Supplement can have a premium anywhere from about $50 to, again, we want to try to stay close to $100, and then your out-of-pocket is really low when you use it. So it can be less than $300 a year out of pocket when you have original Medicare and a supplement. That's one of the main reasons I would only choose that for myself. Also, the ability to go to any doctor, any hospital, anywhere in the country, just gives you all the freedom and the flexibility and the control over what you're going to do with your health coverage as you go forward. So I hope you found this helpful. Stay tuned. I'll show you how to download my book. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit MedicareOnVideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit MedicarePriceCheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be. And likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at MedicareOnVideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.